What's the difference between ADHD combined type versus ADHD inattentive or ADHD hyperactive type? My name is Dr. Ruth Dutton. I'm a board certified adult psychiatrist, and I talk a lot on this app about the importance of providing neurodivergent affirming care. And after a couple of my recent videos, I've gotten several people asking, well, what's the difference between combined versus inattentive or hyperactive type? And I think the confusion is that people were wondering if ADHD was the combined type, meaning that you have both ADHD and autism, but that is not what the combined type refers to. So the combined type is when the person with ADHD meets criteria for both the inattentive and hyperactive elements of ADHD, as opposed to someone who has inattentive type. They only meet full criteria for the inattentive symptoms, and the hyperactive type only meets criteria for the hyperactive symptoms. Now, this doesn't mean that they don't have any symptoms in the other category, but it's that they don't meet full criteria, meaning that they have to have at least 5 or 6 of these symptoms. So let's just review what the different hyperactive versus inattentive symptoms are. So inattentive symptoms include things like difficulty paying attention, getting easily distracted, being frequently forgetful during daily activities, or misplacing, forgetting things, having difficulty with organization, as well as putting off tasks that require significant mental effort, having difficulty listening in conversation, rushing through things and making careless mistakes, having difficulty completing tasks. And then in contrast, the hyperactive symptoms include things like frequently fidgeting, having difficulty staying seated for long periods of time, feeling restless, maybe getting up in situations where it's not socially acceptable to get up, being always on the go, like you have to be doing something all the time, having difficulty engaging in calm leisure activities like reading a book or watching TV, being impatient, like having a hard time waiting in lines, blurting out answers, talking a lot, interrupting others. Now, I do say all this with the caveat that these criteria are not perfect. They were developed looking at young boys, and so we certainly do identify other things as being significant, like things like rejection sensitivity dysphoria, issues with time management, and especially other executive functioning issues. So we usually think of the inattentive type as being more associated with adults and the combined type being more associated with children, and that's because historically we've said that while adults learn to control those hyperactive symptoms more as they get older, the inattentive symptoms persist. However, it's also important to recognize that those hyperactive symptoms can look really different in adults. It might be more of a mental or internal hyperactivity as opposed to something that everyone else can see. So how does the treatment differ? Not significantly, right? As far as medication, we're going to treat either with a stimulant or one of our non-stimulant options like Strattera. There may be some different interventions for behavioral practices and tools. So there may be a little bit more focus on energy management when it comes to people with the hyperactive element. But like I said, most people, even if they have a predominantly one type, are still going to have symptoms of the other types. If you have any questions about this, then please feel free to put in the comments below. I'm also putting together an email list for those who are interested in my content because I may have future courses or offerings, and I want to be able to communicate directly with you all about those things. So if that's you, then send me a DM with your email, and I'll see you in the next one.